Hey, it's Gagana.
And I'm Nithya.
Welcome to G&N Pulse Check.
For today's segment, What's Behind the Mask, we'll be interviewing Dr. Garg, who works at Everett Smiles and is a dentist.
So what are some things that led you to be a dentist, or what really interested you to be a dentist?
So the one incident I can remember which led me pursue dentistry as my career was my visit to a dental school at a very young age. I still remember being fascinated by the clinical environment, how dental students were working closely with the patients, and their experienced faculty was watching them and guiding them. What stood out most to me was how much trust patients had on their providers, and managing their care was very satisfying and rewarding to the providers too. So,
Was this at UW,
no,
school?
it was back in India when I was very little.
How old were you?
I was in 9th grade.
Oh my
maybe.
gosh.
So our school took us to a trip to a dental school, which was in our town. So I met a lot of dental students there, and it was a very nice visit. So that increased the curiosity in me about dentistry, which stayed with me over the years and helped me shape my career and decide what I want to do and become a dentist.
Honestly, that's so valid though.
Yeah, that's so cool to know about.
I wish it was this, like in 9th grade we could also explore like different career pathways.
But we just couldn't.
Yeah,
we really
I mean in
to.
Washington it's like that, but yeah, honestly it's so nice that in India they were able to have that opportunity for 9th graders to be able
Still
to
go back
explore.
in that day.
Aww, I can see that.
No, honestly, yeah, the curiosity like comes from inside, and it's nice that you were able to experience that early.
And it also starts off with childhood, so yeah.
And so then the next question is, what is the most rewarding part of being a dentist?
The most rewarding part of being a dentist is managing patient care. You can be a part of a patient's life. You can improve their quality of life by providing them one-on-one care. So be it relieving them out of their pain, or restoring their teeth to chew, or even giving them confidence to smile. So it's really worth it.
I actually remember I interviewed Rumneet too. She's a dental assistant at Everett Smiles, and this was for a project I had. And she was telling me the most rewarding part was seeing them smile after, and like being completely like emotional.
Some of them, even become teary eyes. So it feels so like deeply personal and nice feeling to improve somebody's confidence, self-esteem. Yes.
People also feel confident and smile.
Honestly, it's really nice that that's something I really want to have in the future as well. In the future of healthcare, like being able to bring someone that
smile. And we would also like to ask you, what's like the most challenging part of your job?
Yeah.
There are some challenges. One of the biggest challenges is managing the dental fear. So patients come with a lot of fear, and also because of the past bad dental experiences. So they are always afraid to come to the dentist. So being able to manage their anxiety along with giving them a quality care is the most challenging part of being a dentist. So you have to be empathetic, you have to have some emotional awareness in order to help them to come out of their dental anxiety. So the challenging part is to work with precision and give them assurance. So you have to take a lot of time to talk to them, to keep reassuring them while doing the treatment. So that is the hard part, but it comes, you need a lot of good, strong communication skills and emotional awareness and empathy to help those patients. And another challenging part, I feel like mouth is a very sensitive area of the body, and it's a very small area. So when you work in it, it's very important. You have to be precise because little bit of error can cause a big consequence. So you need steady hands, lot of focus, at the same time, you have to keep current with the new technology, the
AI,
techniques
AI.
coming out, so, to provide a quality care for your patients.
What would you say is the longest procedure you've ever done, like on a patient? No, because I know you do a lot.
You know, in the beginning, like everything would take longer. Like when I became a dentist, because you don't have that much experience.
Right,
yeah.
Anything, even like I still remember my first day. I was doing a crown prep, like making a crown, which took me like half day, like 4 hours, and patient was still. I was still not able to finish, and I was crying. I'm like, what happened? I couldn't do it. And now the same thing takes me like 15-20 minutes. Exact same thing. So over the time, you get hang of things, and but the longest time there is nothing like that. Sometimes you get stuck in some things, like, or not even the procedures. It's mostly about managing patients, because sometimes they have strong tongue pressure, or they have anxiety, so or their mouth is, they cannot open too wide.
So it
those
doesn't really
things make it
depend on
easy.
the procedure. It depends
It
on like
depends
the
on
patient too.
the
a lot of
situation, the
factors.
person.
All of those things play a big role in providing the care
Yeah.
and the treatment.
I feel like a lot of people don't know about it. They're just like, being a dentist is easy. They just like treat.
I mean,
they just,
I
like,
feel
look
like
at-
a lot of people see dentistry as like such a high thing,
yeah.
and like obviously it is,
It
yeah.
is.
And there's like, I think it's just there's a lot of different factors that play in part of like your job, day-to-day lives. Like, and honestly, it also like patient care is also one of the main big things, right?
Yes,
More
yeah.
than clinically, it's also patient like. Administratively
Patient
also,
management,
yeah, because I see how you like manage the claims, all this insurance, this, that. Honestly, it's, yeah.
And I also see like how many challenges you guys face, and like how hard your day life is.
Yeah, and
Yeah.
you actually have your own practice. Like, you have your own practice and all that. So, and how is that? Do you think that's different? How do you think having your own practice is different from being a regular dentist? Like,
Oh,
Yeah.
it's very different when you when you have your own practice. You wanna, it's like your own baby, so you wanna take care of it.
Yeah.
You wanna give quality care to your patients. Being an associate, you still do the same things, but you don't have to manage a lot of other stuff, like manage the staff and manage like all the equipment, all the building stuff, and order stuff. You have to make sure you have everything in the clinic. So hardest part is managing the staff when you have your own business.
and then, if as a regular dentist, like, do you manage the claims and insurance as a like outside
Like in
of having-
general,
Yeah.
you don't have to.
Yeah.
You have like a good trained persons, but you have to pay them a lot to manage all of this stuff. So they can manage it. These days things are improving a lot, techniques and technology. So there are online like a lot of new websites coming in which can do those things for you. So you don't have to really do them. I am just learning it, so I want to take care of it for my patients, so that their claims don't get denied and they don't have to pay out of pocket. So I try my best to provide them the best estimates and give them the good care.
And also, as teenagers, we always think about like, what is like the most common issue like teenagers come to a dentist, and why do you think this is? Like,
Yeah.
why do you think this really is?
Yeah, that's a very good question though. In the teenage, like there are so many dental issues I see. One is like having a lot of cavities, and then a lot of gum issues. You must have seen some misalignment, lot of crowding, ortho issues, and some enamel erosion. So what happens when you are in teenage, your dietary changes. You start increase the intake of a lot of sugary stuff, like lot of sugary drinks, and your diet change, and plus you don't prioritize brushing and flossing because your life is so busy. You have busy schedule in schools and stuff, so you don't prioritize brushing, flossing enough. Then you get a lot of plaque accumulation, which leads to a lot of cavities. And then gum issues are also a big concern, because in adolescence your hormones are changing, which causes like gum inflammation. That gum inflammation can increase, your gums are more prone to get gum disease.
So
If you
hormones actually have an effect on
yeah, because they affect the blood supply to
Oh.
your gums. So you have a lot of new blood supply in your gums, and what happens with your gums being swollen all the time, if you're not doing proper hygiene, like at home you're not brushing, flossing, you can end up getting gum disease. So that is another common thing I have seen in teenage. Plus malaligned teeth is another concern, because it's a very good age when you don't have any baby teeth, you have all the permanent teeth out, and you are still growing, so you can easily fix those malaligned teeth with some braces, or these days with like aligners, teeth aligners.
So orthodontics.
Yeah, ortho, you can do that to fix those. So those and enamel erosion is another thing I have seen in the teenage kids. So we increase the intake of sugary stuff like acidic, like soda and stuff that can cause your wear on your enamel of the teeth, which makes the teeth more sensitive. So those are the common issues I have seen, but I think with the proper care it can be managed. It's just
the basics.
And also talking about like hormones, we were wondering if like it's different for like women and different for men, or is it just like,
is it the same?
No, it's for both. I have seen in both male, female, both have the same issues in terms of gums, dental health.
Okay, yeah, that's really cool to know about. Like, we gotta like change our habits as teenagers.
No, one thing I got out was like I did not know that hormones can actually affect the gum. Like,
like same thing happens during pregnancies too.
Oh, actually?
When people are pregnant, their gums get really swollen and inflamed. That's very same. Another in like diseases like cancer and diabetes, where your immunity level is low, you can again get a lot of gum issues too.
So I see now why people like tell you to actually take care.
Yes.
Like, a lot
So
during this time.
dental is not just the teeth.
it has an effect on the rest of the body.
too.
Yeah, it does associates with your overall health.
Yeah, I feel like a lot of people just assume that like
It's
dentistry
all
is
the
just on the teeth. It doesn't like impact any other parts of your body.
You can get a lot of disease. We've been told like heart issues, like you can get heart attacks because of there's a big study on that. The bacteria from the mouth can travel to your heart and cause heart issues.
Yeah. Oh my god.
So I'm gonna actually look into that because
That's
that's really interesting.
You can read anyway.
I will
It's very
probably
common.
will,
Yes.
Yeah, I feel like that's really like important for people to understand why.
I actually did not know that. Like,
You should.
Yeah.
You should keep your teeth clean and healthy.
Yeah, and then one last thing, like what's one simple habit or tip you have for students our age or like teenagers that you think we need to know more?
Like an important message or something.
Yeah.
See, in order to keep your mouth healthy, I would say brushing, flossing, both are important. But if you have to choose one, it's really hard. But brushing for me is the most important thing. If you can brush twice a day, especially before night, that is the effective way of keeping your teeth clean and gums clean and disease free. So brush at night. Don't rush, just do it for 2 minutes, do all around your teeth. I keep telling all the teenagers.
No, I always
but
hear you telling
they
them.
take 10 seconds, okay, I'm done. Even with my own son, he does the same thing at this age, but I keep telling him, I gave him the time like a thing.
That's valid though.
Yeah, like so that you need to know. I even bought a electric toothbrush which gives you the timer, so you have to go on for full 2 minutes. So that is most important, and don't drink or eat anything after that. So because if you brush at night, you can keep your mouth clean for long hours. And if you sleep with the food in your mouth or any drinks or anything, it stays on your teeth and causes a lot of bacterial infiltration, so which causes more issues. So if I have to choose one habit, just brush at night.
Yeah, that's I feel like that's really very
Good
important
brushing
after.
at night. During the day, it's up to you. Whenever you get a chance, so you can brush and floss. Flossing once a day is good enough. It doesn't have to be a right time. You can do any time of the day. So that's what I keep telling all my young patients. But I don't know. Some of them listen, some not.
I also feel like parents gotta like get their kids to a habit where they brush their teeth.
I feel like when you start young, then
that's
you
it.
continue the habit.
Yeah.
I also feel like parents should know about it. Also be educated on how to like get your child to brush every day.
Yeah,
at night.
and I feel like we should end on that note. That everyone has to brush and
their
floss
teeth.
every day, guys. Come
Floss,
on.
yeah.
Yes.
Yeah.
And yeah, that's wraps. On to the next segment.
episode. Bye.